Liam and his twin brother Edmund were diagnosed with twin-to-twin transfusion at 17 weeks. 1 week later, we lost his brother, and we were told the chance of Liam making it was very unlikely. But he did. He fought despite multiple complications. At 30 weeks, I gave birth to my beautiful boys, and Liam began the fight of his life. His first few weeks of life were tough. Some days were good, and some days were bad. But he proved to be a stubborn boy and came home 10 weeks later. The afternoon we left the NICU, we thought, this is it. Our family of 4 is finally home together. It was a day we would never forget. 4 weeks later came a night that my husband and I will never forget. Liam came down with what we thought was a cold on March 11th, coughing, runny nose, and occasional labored breathing. We were like any parents of a preemie, nervous as hell. We saw his pediatrician on Tuesday, Wednesday, and Thursday morning. He had an x-ray and his lungs looked good. It was a cold, and we just had to get through it. Thursday night, as we sat at my parents' house visiting, I noticed Liam was becoming pale and lethargic, his breathing was labored, and his mouth looked like there was a tint of blue around it. My husband and I became nervous, and I said, I'm going to take him to be looked at. I chose Leominster Hospital because I knew they would have a pediatrician available to assess him. When I got to the ER and took Liam out of his car seat, I was shocked at how much more blue his appearance had become. The waiting room was full, and we were taken directly into triage. It was 9 p.m. As I started to explain Liam's preemie history and symptoms of the last 2 days, the nurse simply picked him up and said, we're just going to go back to the ER. I sat down on a stretcher with this little boy who seemed completely defeated, and panic began to take over. But within minutes, we were surrounded by 4 nurses. A nurse was getting him onto the monitor and quickly noted his oxygen level was in the 70s, nowhere near the 98 that he was in the pediatrician's office that morning. Another nurse was suctioning his nose and sending off a sample to see if he had RSV, a respiratory virus that is every preemie mom's worst nightmare. Another nurse was hooking him up to oxygen and administering a neb treatment to help get his oxygen levels up. And a fourth nurse was looking for IV access, a feat that is extremely difficult on a 4-pound baby whose veins had taken a beating in the NICU. My husband arrived in the midst of it all. He doesn't have much of a medical background, but he knew that Liam was not in a good way. He looked at me and asked, should I be panicking? And I said no. He is in good hands. We have 4 nurses and 2 doctors taking care of him. It's going to be okay. It hadn't even been 20 minutes, and we had a diagnosis of RSV and an ambulance on its way to transport us to UMass Medical Center because Liam was going to need ICU care. 20 minutes later, we were stable enough for transfer, loaded into an ambulance, and sent to UMass Medical Center. A total of 40 minutes in the ER. It took us close to 40 minutes to get to UMass, and 40 minutes later, our sweet little miracle stopped breathing. His tiny little body could not take it and needed to rest. It took 4 tries to get Liam intubated and on a ventilator. The last 2 tries were by an extremely experienced pediatric trauma attending. Later that night, my husband and I sat in the PDICU room, and I just kept saying, what if we were on 290? What if he stopped breathing in the ambulance? Don't get me wrong, the EMTs were great, but there were 2 of them, one driving and one sitting in the back with Liam and monitoring him. How would they have ever gotten him intubated and ventilated in the middle of a highway? The fact that 4 nurses were available to help stabilize Liam and get him ready for transfer is one of the reasons he didn't stop breathing on 290. It is why our little boy will celebrate his first birthday in 5 weeks. The ER was packed that night. There were other patients who needed care. What if a trauma had rolled through those doors at the same time? Would we have spent more time in the waiting room because there was not enough hands on deck? What if a gunshot victim was dropped off at the ER doors? Would Liam have been put on hold because a patient losing blood was more critical? It scares me to think that his care could have been inadequate because of cuts in nursing staff. How do you explain to someone, we wish we could have done more for your loved one, but we just didn't have enough staff? Liam spent a total of 20 days in the pediatric ICU. His first week was extremely critical. But today, he sits over there with my parents as an active little 11-month-old. The staff in the Leominster ER played a huge role in keeping my son with me. They are the reason he is here tonight and will be giving me gray hairs for the rest of my life.